On behalf of the management and the executive at Geelong, on this Super Support Services Day, we would like to say thank you for the dedication that you provide to our patients to ensure this hospital runs smoothly. From the warm welcome and the greeting you give to our patients, guiding those patients through the administration process and the paperwork they need to complete, the administration and the welcome that they get on the wards, the amazing food that you create and deliver to our patients with such courtesy, ensuring those rooms are like a 5-star resort, they're nice and clean, and also meeting infection control standards at the same time. Ensuring those goods are delivered from the warehouse all the way up to the wards at the right time when our nurses and doctors need them the most. Ensuring the surgeons have their equipment in the right place at the right time and how they exactly want it. That the building as a whole is kept in a fantastic condition and running smoothly, and also making sure those patients are actually moved around the building, at the right time and in a safe manner, and at the same time giving them great courtesy at the time when they need you the most and need to be feel safe and welcome. Even down to the billing process and ensuring our patients get accurate bills and understanding what they actually mean. The list goes on, and it's endless, and just making sure that this place runs smoothly and our patients and nurses and doctors are well supported is all down to you, and we'd like to take this opportunity to say thank you.
In ICU we work as part of a multidisciplinary team, and our support services are very much a part of that team and help us do what we do, particularly from the environmental staff and cleaners who help us provide infection control and the cleanliness of the unit, and really help us turn over the rooms as quickly as we can when we need an urgent admission or something like that. So that is absolutely integral in being able to provide that care in the right environment.
The ward clerk is an integral part of the team up here on 5 East. They're the oil that makes the wheels turn on a daily basis. They're vitally important in keeping the lines of communication open, and they're often the face, the front of house that the patients and visitors meet at the first point of call, from wayfinding to showing patients to their rooms to the day-to-day tasks of a ward clerk. Their seamless work and tireless work is endless, and they're the glue that holds it together.
With our PSA and orderlies, we rapidly need to get patients to and from theatre, and they assist us with that with really terrific efficiency and expertise and really very compassionate care also.
The ward hosts are an integral part of the 5 East team up here at Epworth Geelong, where they help provide a seamless journey for the patients in ensuring that they're getting their nutritional needs and food preferences. They help the nursing staff and the ward clerks ensure that food allergies are identified early.
I think the theatre techs at Epworth make an enormous difference, both to the patient journey but also to the way clinicians feel. Certainly there was one particular day that sprung to mind where we had a very busy list with 3 craniotomies, and one of the senior techs came back in after having gone home to come and help set up, which made an enormous difference, because at that hour and with that acuity you don't have the luxury of time, and so I think it makes an enormous difference in patient outcomes, but also in how patients feel. I know, having spoken to patients post-operatively, that they feel that they're very well looked after from the time they come in to the time they leave, and a lot of that has to do with the way that the non-clinical staff make them feel as they're moving from area to area.
There have been circumstances where we've needed to return patients to the cath lab very urgently, and there was a recent example around a month ago where we needed to get the patient back to cath lab to have an urgent angiogram very quickly, and the support of the PSAs and orderlies in doing that rapidly, getting them there, getting them safely there, and the assistance in moving that and the equipment associated with that was absolutely integral to be able to deliver the care that we needed to do in a timely manner.
Once the communications lines and everyone's on the same page, the rapid turnover of rooms helps facilitate patient flow, and everyone from even moving patients around the hospital as part of their journey from admission through to theatre, through to EMI and the gym and everywhere else, even through to discharge through the CARP system. It appears to be seamless. I'm sure it's not, but they always do it with a smile on their face, and nothing is too hard, and the patients and the staff are very thankful.